Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, my name is Afrida Wardhani. I'm the second semester student of Medical Record and Health Information Department. In this occasion, I would like to present about quantitative and qualitative analysis from the two examples of medical record templates. What is quantitative analysis? Quantitative analysis is the review of a certain areas of the medical record to identify deficiencies in the records, especially those related to medical record documentation. Quantitative analysis identifies specific deficiencies. These deficiencies must be resolved by the healthcare provider in a short time. Components of quantitative analysis. 1. Patient's identification on every form. At least each form has the patient's name and medical record number. 2. The existence of all important reports, like general consent, admission form, anamnesis, nurse's note and physician instruction, patient progress, also discharge summary. 3. There is author authentication or record validity. Authentication can be in the form of a name or stamp or initials, a signature, someone's code for computerization, and there must be a professional title. 4. The creation of good recording or documentation. Checking incomplete records. If there is a wrong note, then it's outlined and give a note on the side. This is the example of quantitative analysis. In this template, the patient's medical record number was not filled. In the quantitative analysis, the patient's medical record number is the part of patient's identification, so it must be written. What is qualitative analysis? Qualitative analysis is a review of the contents of the medical record for inconsistencies and omissions, which can indicate that the medical record is inaccurate. The analysis requires knowledge of medical terminology, anatomy physiology, fundamentals of the disease process, contents of medical records, and licensing standards, accreditation, and certification bodies. So it's performed by a qualified medical record practitioner. The aim of qualitative analysis is to complete medical records as a reference in patient care, protect legal interests, and meet regulatory requirements. Components of qualitative analysis. First, review for complete and consistent diagnostic. A diagnosis statement is made in the medical record which reflects the level of the patient's medical condition when recorded. 2. Review for entry consistency. Consistency is an adjustment or match between one part of the medical record form with other parts. 3. Review for description and justification of course of treatment. Medical records explain the patient's condition during treatment, and it must have all examination results and record the actions that have been taken to the patient. 4. Review for recording informed consent. The patient's informed consent for a treatment should be drawn carefully. 5. Review for documentation practices. Notes should be easy to read to avoid misinterpretation. The ink that used must be durable, and the document must be written completely. 6. Review for potentially compensable events. Medical records must have all records of potential prosecution events. This is the example of qualitative analysis. In the nursing notes form, it was written that the frequency of giving nisergolene is once every 10 hours. But in medication form, the frequency of giving nisergolene is once a day. This inconsistency in data entry can lead to misunderstandings in the patient care process and will be a question in the physician's evaluation. That's all of my presentation. Thank you for the occasion and attention. Have a great day. Wassalamualaikum warahmatullahi wabarakatuh.